In a world filled with flavors and choices, one popular e-cigarette brand faces a major setback. The US Food and Drug Administration, or FDA, has issued a marketing denial order to R.J. Reynolds Vapor Company for its Vuse Alto brand. This decision is the culmination of an exhaustive evaluation of public health standards and the societal impact of these flavored e-cigarette products. This move by the FDA raises crucial questions about the vaping industry, public health, and the role of regulation. In this video, we'll explore the reasons behind the FDA's decision and its implications for both the vaping industry and our society as a whole. The FDA evaluates pre-market tobacco product applications, PMTAs, based on a public health standard, ensuring that the products benefit the population as a whole. This standard is a critical part of the FDA's mission to safeguard the public's health, and it's the lens through which all pre-market tobacco product applications are evaluated. Matthew Farrelly, PhD, Director of the FDA's Center for Tobacco Products Office of Science, gives us a glimpse into this process. He says, "We review each application on its own merits, and it's the responsibility of the applicant to provide sufficient science to support the product they're seeking to market." In other words, it's not enough for a product to simply be less harmful than traditional cigarettes. The company must also demonstrate that their product will not lead to an increase in tobacco use among non-smokers or young people, and that it will indeed help smokers to quit. In the case of Vuse Alto, the FDA found that the applications lacked sufficient evidence to demonstrate that these flavored products provided a significant benefit for adults who smoke cigarettes. The company could not show that their menthol and mixed berry flavors were more effective at helping adult smokers quit than tobacco-flavored products. These flavors, however, are known to be especially appealing to youth, leading the FDA to conclude that the risks of these products outweighed their benefits. The FDA has received applications for more than 26 million deemed products and has made determinations on 99% of these applications. The Center for Tobacco Products continues to make meaningful progress in reviewing the unprecedented amount of pre-market tobacco product applications that have been received, said Brian King, PhD, MPH, Director of the FDA's Center for Tobacco Products. "We're committed to completing review of these applications as soon as possible, while ensuring that they undergo a rigorous scientific review in accordance with the law." The products in today's denial orders cannot be legally introduced into interstate commerce in the US. If the product is already on the market, it must be removed from the market or risk FDA enforcement. To date, the FDA has authorized 23 tobacco-flavored e-cigarette products and devices, which are the only e-cigarettes that currently may be lawfully sold or distributed in the US. These authorizations include other products under the Vuse brand, including tobacco-flavored Vuse Vibe and Vuse Zero devices, and accompanying cartridges. Applications for 6 tobacco-flavored Vuse Alto products remain under FDA review. Vuse e-cigarettes, which include the Vuse Alto sub-brand, have become the second most commonly reported e-cigarette brand used by youth in the US since 2021. This is more than a mere statistic. It's a stark reality that points to an alarming trend. The popularity of these flavored e-cigarettes among our youth raises serious concerns about the future health of our society. The increasing use of Vuse Alto products among high school and middle school students presents a significant public health risk. The sweet allure of flavors masks the harsh reality of nicotine addiction, presenting a dangerous path for our younger generation. Here's what Brian King, Director of the FDA's Center for Tobacco Products, has to say about it. "Our commitment is unwavering, and we are dedicated to protecting our youth from the perils of e-cigarette addiction. Our actions and decisions are guided by this commitment, and we will continue to work diligently towards creating a healthier future for them." These statistics are not just numbers, they represent real lives and futures at stake. Let's not forget, behind every statistic is a story, a life, a future that could be derailed by the harmful effects of e-cigarette use. Our youth are our future, and we must prioritize their health and well-being. The FDA has been working tirelessly to review and authorize tobacco products that meet their strict standards. This steadfast dedication to public health has led to the approval of 23 tobacco-flavored e-cigarette products, each thoroughly evaluated for their potential risks and benefits. However, the journey doesn't end here. The FDA continues to meticulously examine each application to ensure the protection of public health, especially our youth. In the case of Vuse Alto, the current roadblock is not the end of the line. Despite the marketing denial order, the door remains open for new opportunities. Yes, for now, these products cannot legally be introduced into interstate commerce in the US, but that's not to say it's a permanent goodbye. The company has the option to submit new applications for the denied products. With rigorous research and a comprehensive understanding of public health implications, there's hope for these products to meet the public health standards in the future.